Hi everyone, my name is Dr. Riwa Sabbagh and I am the third year infertility fellow at Boston IVF. I am going to be graduating in 2 months and I am happy to be staying on at Boston IVF as a reproductive endocrinologist, and I'm hoping to meet some of you in the near future. Today, I'm not going to talk about infertility per se, but a topic that's very much related, and I'm going to talk a little bit about fertility preservation. So for fertility preservations, there are different options for fertility preservations. We have egg freezing, sperm freezing, as well as embryo freezing. I'm going to focus my talk a little bit mainly on egg freezing, but we'll also touch a little bit upon embryo freezing. So egg freezing has really increased dramatically over the past few years. A lot more patients are going through egg freezing. And we recently found out that just in our center, it has increased about 93% just this past year. And there are different reasons that individuals may elect to proceed with egg freezing. It could be for totally elective reasons. But other indications for egg freezing could be for medical purposes. For example, if someone has a diagnosis of cancer and is going to go through cancer treatment, so they may elect to proceed with egg freezing prior to treatment. We also can use it for or prior to gender affirming treatment for our transgender patients. A common question we get asked is when to freeze eggs. There isn't a specific right answer on when to freeze eggs, but in general, I would say if you're somewhere in your early to mid 30s and are not planning to have children anytime soon, and it is important to you to have children that are genetically related to you, then that would be a good time to start thinking about egg freezing, or at least meet with a reproductive endocrinologist to start discussing the process. In terms of how many eggs to freeze, that's another common question we get asked. Again, no specific right or wrong answer, but usually we would say aim for a good number of eggs that will give you a high chance of having a baby. Now, what a high chance, different people have different perceptions of what's good and what's a high chance. And when you meet with a reproductive endocrinologist, they can share some numbers and some probabilities with you as to how, what chances you have depending on how old you are. And then you can decide what is an ideal number for you. In general, we know that as we get older, the quality and the quantity of our eggs start to decrease. So we may need more than one cycle to achieve that adequate number of eggs that you may want. And that number depends on your age, can depend on your egg reserve, but also on your family building goal and how many children you wish to have. In terms of cost, I know cost is always a big question that a lot of you may have. Where more and more insurance companies are now starting to cover egg freezing, but it's still not really in effect in commercial insurance companies. But for example, for cancer patients or transgender patients, we tend to try to get coverage. But the majority of patients, I would say, usually pay out of pocket for egg freezing. And a ballpark cost per cycle is somewhere around $10,000 to $15,000. And that, like I said, is per cycle. And it usually includes, or it does include, medications that you will take, the monitoring that you'll go through, as well as the procedure itself, the egg retrieval procedure. Now, what the general process of egg freezing looks like, so you'll meet with a reproductive endocrinologist and talk about the egg freezing process. They will order some testing to look at your egg reserve and so on. And then based on that, we'll formulate a treatment plan for you to go through the egg freezing process. And once you start, it's generally about 2 weeks. During that time, so it starts usually with the first day of your period, and you're taking injectable medications for about 10 to 12 days, daily injectable medications for 10 to 12 days. During that time, you're also coming in for monitoring roughly every couple of days, sometimes can get more frequent as you get closer. And what we're looking for is basically your response to the medication. So are your hormone levels going up appropriately? Are your follicles growing up to a decent size? And so that's what we're looking for. And once you get to a point where we think you've reached a decent number of follicles with a good size, good hormone levels, you'll take a trigger shot. And then you'll come in for an egg retrieval around 36 hours later. And the egg retrieval process, most people tolerate it pretty well. It's about 15 to 20 minutes. You are asleep. You get IV sedation. So it is considered general anesthesia, but you don't need a breathing tube. You're breathing all on your own. And it's 15 to 20 minutes, and you go home the same day. Most people don't take time off of work during this whole process, during the 2-week process, just the day of the egg retrieval so that you can come in and do the procedure and you are getting IV sedation. But it's usually a very quick procedure with a quick recovery time. And once that process is over, we freeze those eggs. And the eggs are frozen indefinitely. They can be frozen for an indefinite time. And then when you are ready to use these eggs, we thaw them and then we fertilize them with sperm and then create embryos that we can use to transfer in a uterus. This is what the process looks like for egg freezing. Now, when it comes to embryo freezing, usually it's the same process all the way up until the egg retrieval day. And then instead of freezing eggs, we fertilize them with sperm that day, watch them grow until they create embryos, and then freeze those embryos. And so in the future, when you're ready to use that embryo, we just thaw it, and then we can transfer that embryo in a uterus. And I want to urge you all to reach out and consult with a reproductive endocrinologist if you're struggling with infertility, to talk about your struggle, see if there are any treatments for you, and also if you're looking to preserve your fertility and talk about egg freezing.